Welcome to Scoop and Scale, where we dish up the science and weigh the facts about mostly equine nutrition. I'm Jill Jackson, lifelong equestrian, podcast producer, and pony owner. I'm a dressage rider and at-home horse keeper, living the challenge of managing easy keepers on multiple acres of pasture.
And I'm equine nutrition consultant, Dr. Claire Tunis of Clarity Equine Nutrition. I develop diet plans for horses ranging from metabolic seniors to Olympic athletes. I also consult for equine nutrition companies. I'm a scientist, dressage rider, and pony club mom.
Claire and I have been horse friends for almost 20 years, and like all good horse friends, we're always talking horses. We talk about the challenges of managing our horses, our riding struggles, feeding horses, and what's going on in the wider equine community. This podcast is a place for us to have conversations mostly about equine nutrition. It's for anyone who wants to make better choices when it comes to feeding their horses.
And before we get started, a quick disclaimer. The information in this podcast is general and not meant to replace the individualized advice of your own qualified equine nutritionist or veterinarian. And while I have a PhD in nutrition, I'm not a veterinarian and can't give medical advice.
With that, thank you for joining us, and we hope you enjoy the following episode.
The last time we got together with Kai, who's a certified equine dental professional with the International Association of Equine Dentistry, we had a great conversation about what makes horses' teeth unique and general dental health. Today, we invited Kai back to finish the conversation and talk about teeth and nutritional health, something that I think is very important and often overlooked. Owners are very quick to reach for supplements and to change food and do all these things when they think their horse is losing weight. And they sometimes forget their horse's dental health, especially if they actually saw their dental professional within the last 12 months. There's sort of an assumption that it couldn't possibly be the dental health, but maybe it is. So anyway, Kai, welcome back to Scoop and Scale.
Hi, everyone. I'm very happy to be back.
All right. Well, we're happy to have you. Let's jump right in. So why is it so important that the horse's mouth works properly and that they can grind their food properly?
So the first thing I think that is very relatable to a lot of horse owners is the feed waste. If the horses doesn't chew well, they might be dropping a lot of food, which is called quitting. And the precious grain that you bought, the expensive hay that you just got, just kind of go into waste and become like just scattered feed on the ground, and then sometimes horses wouldn't even try to pick it up. So the first thing is relatable to every horse owner is the waste of the feed and the cost of it. So the more they waste it, the more you figure, oh, they're not gaining weight, I'm going to add more. But if it's a dental issue, they're just going to quit even more. So it's a constant like adding, but not getting there, and adding more and still not getting there. And it's just a waste of money and time. And also, mouth is the major physical digestion, which is the breaking down of the feed particles. So without a properly functioning mouth, the physical digestion can be very compromised. So then the rest of the horse's body have to work harder to sort through the feed materials, and that's just extra work and energy for the animal to waste. And also, chewing comfort actually matters a lot to horses. Some people might think that they're chewing fine, so they're okay, but sometimes they are actually hiding a lot of like sharp points with cheek lacerations in there, and you just didn't know. And after you did the adjustment, you will see like how more freely the mouth moves, or the pain phase kind of decrease, things like that. And you can tell like the comfort of chewing is a big thing.
Yeah, and I think we talked last time about how horses chew in a grinding motion, right? Their jaw moves side to side. I think when we chew up and down more. like the mechanics of our chewing is very different than the mechanics of a horse chewing, and horses really grind their food. And what you mentioned about physical digestion, I think is really important. And I think it's easy to think about when we think about hay, right? You have this great big long, maybe foot long piece of hay, and we look at the horse's manure, and what comes out the other end is maybe like an inch. So it clearly becomes smaller particle sizes, and that's what the chewing and the grinding does, right? Is it grinds that, when we think about hay, like really long piece of stem into something much smaller. And so particle size is really important for digestion, because like you were just talking about there about the sort of physical digestion, but then we also have like enzymatic digestion in the small intestine, where enzymes get secreted and attached to the food and start breaking it down. And then in the hindgut, we have microbial fermentation, where the microbes attach the food and break it down. And the smaller the particles are, the greater the surface area is. And that can take a little bit, I think, for people to kind of go, huh, what? The smaller the particles are, the more surface area you have. But you do. You have more surface area. And so you've got more surface area for the enzymes and bacteria to work on. So if you don't break your food into small enough pieces, it's not going to be digested as effectively. And to your point about sort of feed waste and throwing money away if they're just dropping it on the ground, if they're not grinding it into small enough pieces that they can use properly, you're also wasting money, because you're not able to get all the nutrition out of all the things you're eating. So particle size is something that's really important. And Kai, is there actually any research on that you're aware of?
Yes. Yeah, fecal particle size has always been something people like to research about. And it can trace back to like the early 2000s that some researchers started noticing it. So the very first research that noticed the like dental has something to do with digestion is back in 2001 by Dr. Ralston. He found that apparent digestibility is decreased when the molar table angle is not correct. And that kind of leads to people start thinking, so what is the correct angle, and how to improve the digestibility, things like that. And then some other researchers like Dr. Carmold, he published like 4 or 5 papers between 2004 and 2008. And he tried to correlate the fecal particle size with the dental condition and apparent digestibility, things like that. Although his findings is not significant, but I think it was one of the foundation and the innovative topics for people to think about. And his research is like 20 years old now, so I think it is a good time for us to like redo it and like rediscover what is new.
Mm-hmm.
And in 2006, by Dr. Pagliosa, they did like enamel treatment, just like buff out the sharp edges, and they do find a significant reduction in the particle sizes. And then in 2017, there's also another one that do fecal particle size checks in donkeys, and they found that the fecal particle size actually decreased like 3 millimeter. I don't know how many inches is that? 1/8, maybe?
Yeah, probably something like that. That sounds about right. About an eighth of an inch. Yeah, about an eighth of an inch.
Yeah, 1/8 of an inch that the fecal particle size reduced. And that was on haylage and oat straw. So those are a little bit more like hardcore chewing material, and they can still find a big reduction. So it is very effective and a good way to reduce the particle size. And a recent research from Purina also shows that the chewing length is longer for horses pre-dental versus post-dental, and chew strength was stronger pre-dental versus post-dental. So post-dental actually helped them to conserve some more energy and efficiency for them to chew properly and then break down the stuff efficiently compared to like not doing dentals.
That's really interesting. And I think, to your point, you're sort of saying, well, a difference between sort of like 4 and a bit millimeters to, 1 and a bit millimeters. I mean, I think to the naked eye, or it sounds like a very, I think to most of us here in the US where we're working in inches, millimeters sound tiny. And it seems that like, would I even notice that difference in the manure? And I guess you might not, but it sounds like, there is some research showing that doing dental work does actually help the particle sizes be smaller, even if you might not see it. So that's really interesting.
Yeah, it
I
is. And by pathologically, 3.6 millimeter is the cutoff for being like not chewing properly. So yeah, so I think from 4 to 1, that is a pretty big reduction.
Hmm.
I think too, like, I muck every morning. I know a lot of people board their horses, and so you're not seeing your horse's manure unless you have them in the cross tie or you happen to be there, around feeding time, whatever, and you just clean out the stall before you leave. But I mean, that's something I always look at when I'm mucking in the morning is at the manure of both my ponies just to see if there's been any changes. I mean, obviously, if you're only mucking once a month, you're probably not going to pick up on those changes. But when you are mucking every day, you can definitely tell a lot from the manure what's coming out. And you can easily see the particle size coming through. And you just sort of know what the average is for your horse and can see those changes. But so what you're saying is like if horse cannot chew its food properly, you will be able to see the effects in their manure, correct?
Yes, that's what I'm saying. So if the fecal particle size is it's not well uniformed, that means that the food is not chewed properly, and you will see some shorter length with some bigger length. Like the longest one I've seen is like 2 inches, 1 inch long, and the fecal ball is not really well formed. It's really brittle, and you can just see the long pieces like stuck in there. Looks like a hedgehog, if you would say. Yeah, a fecal ball with spikes. So it looks like a hedgehog.
That sounds like it'd be a
And
problem. Passing hedgehogs is not good.
yeah, so it just looks painful to pass through. So, yeah, I'm able to see that in the manure. And also, some horses even develop like kind of like diarrhea because the fiber length is so ununiformed, and it kind of causes like osmotic imbalance in them. So the fiber part comes out, and then the other finer part comes out differently. So some people saw, like, actually this is a vet case that told me about that. So some horses even have diarrhea because of this.
Yeah, that actually kind of reminds me of the episode we did on fecal water syndrome and the fact that we often, with those horses that have chronic fecal water, will end up suggesting that people feed some amount of their hay as pellets instead of long stem hay we think in part because of some of the irritation that long stem hay has. So it totally makes sense that if your horse's teeth aren't functioning properly and you've got longer, scratchier stems going through their digestive tract, it's going to irritate and what have you. And I do see, I think, a little more fecal water in our older horse population, which, as we spoke about last time, tends to be a population that can struggle a little bit with their teeth, especially if they haven't had good dental care throughout their lifetime. So all these things start to, piece together and make sense, right? And there's also some really interesting research on like stemmy chopped forage and pyloric ulcers in horses, and potentially if you've got a very stemmy, stiff, like mature type hay, and the particle sizes are too big, that can potentially cause irritation on the pylorus and then lead to ulceration of the pylorus in the gastric stomach, which, speaking from experience, is a real pain to get rid of. So you don't want that. So definitely looking after your horse's teeth is a big deal. So you mentioned about the osmotic imbalance potentially, but does anything else change about the manure based on the horse's dental health?
Yeah, so the diarrhea and the fecal particle size is something we can see with our eyes, but there is something that we don't see. You have to use like equipment and lab services to figure out. That is like the volatile fatty acids profile. I'm not sure if you covered in previous podcasts, but they are acetate, propionate, and butyrate, and also lactic acids. It's one of the short chain fatty acids as well. And they fermented the fiber in a large intestine, and the carbohydrates turn into these short chain fatty acids, and it's very volatile. So, in the research, they found that there is a change in the intake of the roughage after dental, and that promotes a shift of the concentrate and roughage proportion in the horse, and therefore cause changes in the VFA in the large intestine, such as the acetate and propionate increase and lactic acid decrease. So it actually changes the fermentation environment. And a lot of times we use the fecal to measure what we see in the large intestine. So it is pretty interesting that you can detect these kind of changes in research setting.
That makes sense, actually, as I sit here thinking about it, because those volatile fatty acids that you're talking about, those are byproducts of microbial fermentation. So if we back up to talk about particle size and we say, well, if you don't have good teeth, your particles are larger, you don't get such good microbial sort of adhesion of microbes onto those particles, so you don't get so much fermentation happening. The bacteria don't have as much surface area to work with, and so they're not going to create as much of those volatile fatty acids. So it all kind of, again, just kind of works together and totally makes sense what you're saying.
Yeah, and I think we talked a little bit about that on our pre-pro and postbiotic episode. I don't think we went that far into it, but we did.
I think maybe we did
touch on that a little bit. So you could be feeding your horse the right diet and the right amount of food, but if it isn't chewing its food effectively, it can still be underweight.
Yeah, absolutely. Right. So anytime I do a diet for a horse that on paper is being fed significantly more calories than are stated as being required for that horse, and the horse is underweight, or possibly it's just in good weight, I wonder what's going on. So, for example, I've had horses in work who are consuming 50% more calories than the requirement says they actually need for their size and work level, and yet they're barely in a good weight. And so I always kind of think, what is going on here? Like, why is this horse should be fat? It's eating 50% more calories than it's supposed to, and it's not fat. Something is definitely going on there, and it's a red flag. And dental health always comes up for me. It always puts it on my radar, and I'll always ask the client, when was the last time your horse had a dental checkup? And often they'll say, oh, it was only 9 months ago or whatever. And I'll often encourage them to perhaps revisit that, because as we heard last time, sometimes things happen. And even if you did have a dental check in the last 12 months, it can be worth looking again. It's one of the things that I love about the vet that I use for my vaccinations, who's also a very good dentist. She sees our horses, twice a year for vaccinations. And even if she's there just to do vaccinations, she's opening the mouth and looking in the mouth to make sure that she doesn't see anything obvious amiss. And so they're getting a visual dental check every 6 months, and then typically getting worked on once a year.
Well, I know in our previous episode, we did an episode about feeding pellets or hay cubes when long stem hay is not available. And we talked about the increased digestibility of hay pellets versus hay because of the smaller particle size in hay pellets. And what we're talking about here ties right into that concept.
Pellets take away the hard job of chewing. However, horses on complete feeds tend to have more malocclusions or dental problems, because in 2007, Dr. Hilary Clayton has a study that does the range of motion of the mouth, and they found that chewing long stem hay has a bigger range of motion than chewing concentrate. So that didn't the smaller concentrates or the pellets that they chew on can actually cause incomplete lateral excursion, and then cause the malocclusions to come out or be more prominent. So There's no specific hay type on like malocclusions in research setting yet, but it is very well known that pellets take away the hard job of chewing and then can cause more malocclusions. But also, if a horse they just don't have much teeth left or they are having a lot of dental pain when chewing, giving them pellets definitely help out with their mouth.
Yeah, it's like all these things, like it's like a risk benefit, like everything in horses, right? It's kind of like, it's like the sort of pros versus cons of everything. And I think like what you said just there about like if you have a senior horse that really doesn't have many teeth left or, whatever, then you kind of have to use pellets. And that's sort of the purpose of them is they're almost pre-chewed basically, right? But
Yeah.
yeah, it's interesting what you say about different diet types because, there's a lot of, I think we talked about it in the last episode too, right? Horses grazing, again, it's different mechanics and if they have their heads up and that kind of thing. So it totally makes sense that eating pellets versus having that full motion of eating hay would make a difference.
Yeah, and there is another thing that kind of resembled what Jill just said about like increased accessibility with the pallets. They found in research that after dental reduction, the fecal particle size changes. The change is also related to the roughage digestibility as well. And they compare like four different cuts of fescue, prenail, ryegrass, or clover mix, and straw, and they all see that difference. So, like a lot of time, the roughage digestibility can kind of be estimated by fecal particle size. And to know, like for sure, the true scientific method is do like sieving of the fecal material, and you can also rank it by the sieving to know what's the forage digestibility.
Interesting. I moved a gelding with me from Arizona to Connecticut. That seems like so long ago, but anyway, he had started losing
That was
weight.
a long time. That's because it was a long time ago.
It was like 20 years ago, wasn't it? Was it that long ago? It's really a long time ago.
That's a long time ago.
Okay.
Yeah.
20 years ago, I moved a horse from Arizona to Connecticut, and he started losing weight, and he was getting an entire bale of hay a day, and he was still losing weight. And he'd been seen by a dentist in Arizona right before we left. It was less than 6 months, but we had the dentist out after crossing off everything else on the list, and sure enough, he had a dental issue.
Yeah, so in these kind of scenarios, it's really hard, especially when moving, they can lose a lot of weight. But if they don't pick up like or settled in 2 months, I would say after they get to the new place, I would recommend a dental check because the first thing is not all dental work is the same. So, IED certified individual, they have the IED standard, like to do incisor work, to do cheek teeth work, to check for occlusion, things like that. But if it's just another layperson, I've seen some people use various rats to do the teeth as well. I personally think it's really gross because you put something on a foot and then put it in the mouth. So, there are different levels of practitioners out there, and finding somebody that's like credentialed is always important. And secondly, some treatment and adjustment requires a long-term routine care, such as extreme cases like waves or shear mouth, or even a big protruding tooth can take like a lot of adjustment to get it to where it should be. So reversing a bad mouth takes time. And I personally have a horse story, Pom Pom. It's a client's horse, and he has always been head shy, and we just thought that's his personality. But after I checked the teeth and do the dentals, his head shy went away and likes to rub on people now. So it was very surprising. And this horse, their sharp points come back really fast. And this horse but was having loose teeth issues, but I didn't want to pull any of them because he won't have any tooth left. So I just do better balance and equilibration on him, and then the tooth actually tightened back up. And but it takes like 3 years for it to be normal and not needing intense every 4 to 6 months checks. So yeah, it can be a very major dental problem if the weight is just not coming back up. And also other issues can also happen, like a lot of horses with PPID, they can have health issues and also impact on the dental materials, like they get caries more often, like how they metabolize the carbohydrates is different. So also screen on other issues, do like a full workup. I would recommend that. And last but not least, I would say just like the last episode, we mentioned a lot of details in what an appointment would have, and that is something the owners should observe, and then so they have an idea of what kind of level of practitioner they're working with.
Yeah, and I think it's something you mentioned there about PPID is interesting. We didn't talk about this last time. We were talking about I always get the letters the wrong way around. Is it EORTH or EROTH? I always get them the wrong way around.
EOTRH.
Thank you. We were talking about this last time, and I meant to share that the very good dentist that I work with here, when we discussed some of the cases that she had found in the barn that I was in, and while she was doing that, she shared that she sees a connection between that condition and horses that have PPID. She sees it and so we actually tested some of those horses, were senior horses and could have been in the window for having PPID. And so we actually tested them. And sure enough, one of them actually did test positive for PPID. So I thought that was really interesting. So I think that's, if you have a horse with PPID, they do tend to struggle with immune issues, and some of these dental conditions, can be related to immune function. So I think it is important to kind of keep that in mind. And we have a whole episode on PPID. I can see Jill
No, I just want to, you guys have just said PPID 600 times in the last 10 minutes. It's also called Cushing's, which most people call it. So we just want to make sure that people understand that Cushing's is what we're talking here.
It is.
PPID.
And I'll tell you why we call it PPID, though, because actually we do call it Cushing's, but it's actually not the same as Cushing's in dogs and other species. And so PPID is the more accurate term. But I realize that most of us, myself included, when we're out and about, just call it Cushing's. So yes, Cushing's, that's what we're talking about. And we do have a whole episode on it. So if that kind of sparks your curiosity, go check that out. But I think that I'd throw out too that just when we're talking specifically about weight loss, and we're kind of focusing on dental health today, but I just wanted to throw out, especially if you have really any age horse, but especially our older horse population, perhaps, who are struggling a little bit with some sort of osteoarthritis and stuff, it's really worth having, Kai, you mentioned it briefly, having a whole workup with your veterinarian. And I had a case years ago now of an older horse who lost a significant amount of weight in quite a short period of time, and it was quite alarming to the owner. And they did all kinds of blood work and checked it for PPID and all these things that they thought might be contributing to it having, losing weight so rapidly. Nothing came up. It seemed fine. And on a whim, the veterinarian decided to do a lameness evaluation on this horse. And he was sort of semi-retired, mostly just sort of a walk trail husband horse. So it wasn't like he had to exert himself greatly for anyone to really notice. But on a thorough lameness evaluation, he did actually flex unsound and had some hock pain, and they took care of that hock pain, and he immediately regained weight. And I think it's easy to forget that how stressful it is to horses to be in pain. As a flight animal, they mask their pain really well, and it's a high level of stress to be in pain, as anybody who deals with long-term pain will know. And you end up with elevated cortisol, and cortisol kind of makes it does funny things to your metabolism. So I just kind of throw that out there. If you're struggling with a horse, keeping weight on it, you really do need to get a vet to look at the whole picture. And don't be surprised if the vet suddenly says, let's do a lameness exam, when you're thinking the horse isn't lame. There might be something going on that needs to be taken care of.
Yeah, I think that's a good point. And I think that, I see it on social media all the time. People going, my horse just lost all this weight, And a lot of people say, just add a fat supplement, just feed it more. It's like,
God.
that's not the answer. Like, there's a reason why your horse is losing weight if they were in good condition before. Like, you need to start with your vet, not with Facebook. Start with the vet.
Yes.
You need to step back and look at the whole picture and not just like throw stuff at it. Yeah, absolutely.
Right. Besides weight loss, what other factors should horse owners look out for that might suggest a dental issue? And I'm going to answer this question first with mine, because the same horse that I took to Connecticut 20 years ago, when I bought him, the seller had told me that he has a really terrible smell in his nostrils all the time. There's never discharge. They had the sinuses scraped. They had the head x-rayed. They had done everything, couldn't find anything. When I did the vetting before purchase, on the pre-purchase, we looked at everything. The vet couldn't find anything. The smell was horrific. When I sold him, the vet, I let the people know that were buying him the same thing. Their vet also did a bunch of tests and looked for it. Could never find anything. But I know that's on your list, and definitely my case was not the normal. There should have been something causing that smell, but I would say that's a good one to have on the list. I did all my due diligence. We just couldn't figure out where it was coming from.
Yeah, the bad smell in horses, they can be gingivitis, they can be periodontal disease, or just really old feed packing in the gap between each teeth and just sit there and ferment, and it just makes a manure like smell to people. So that is definitely one thing to be on the lookout for. And some other factors, I would say, like the head shy I mentioned, is not all head shy horses are having dental issues, but that can be a sign. And also excessive drooling, if they have more dental pain or if they have more oral lesions in the mouth, they can drool a lot. And also quitting, the dropping feed that we mentioned earlier. And other research also showed different kinds of behavior. They actually mapped out like 20, 30 something behaviors, such as like frequent pauses in eating, head shaking or head tossing, change in eating, drinking, or even riding habits, such as having biting issues or head rubbing. And also the grimace scale is pretty prevalent to be used now. It's the pain face. And also like large or undigested feed or long stem hay and whole grain in the manure is another thing to look out for. But there's one thing I want all the owners to keep in mind is that 80% of the horses show no signs, even if it's a severe situation. I once had a horse that has a fractured teeth. They fracture through the middle, so the teeth is split into two ways, and one side is poking into the cheek. But that horse has no signs of like discomfort. You can't really see it from the outside. And the horse rode in a hackamore, and the owner said there's not really any major issues with riding in hackamore. But when I opened the mouth, that was a big surprise. So sometimes when you wait until you see signs, it can be like very severe already.
Yeah, so really a reason to have those, frequent, visual dental checks, even if you don't end up doing any work, having a qualified professional just look in the mouth and assess the head can be so important. And, I think your point about performance issues is good. And, I've had experience with that, with a horse that started sort of hanging on the rein and opening his mouth, and something he hadn't ever done before. He tends to be very light in the contact. And, so that was unusual. And we actually noticed on a dental exam that he was developing a bit of a wedge, and we planned to take a look at it again in 6 months. But, in the meantime, these issues under saddle came up. And so I called my vet out and determined that the wedge was coming back. And she found that he had a very sore TMJ. And so ended up actually treating him for TMJ issues in the hopes of preventing a larger dental issue from developing, and also helping him to be happier under saddle when he's being ridden. So I definitely think that looking into similarly, I've also had rein issues linked to, lameness though too. But it's I think that it's important not to discount. If you start noticing your horse doesn't want to turn left or doesn't want to turn right, or changes in your rein contact or whatever, something may be going on physically, whether that's orthopedic and lameness or oral and in the mouth. Like, don't just discount it. Investigate what's going on, because it can be pain related.
Yeah, I totally agree. And then there's some research trying to find a performance link with dental. And there's actually one that just got released. I was reading it right before our podcast, and it is about a barrel racing competition. And they do their teeth like before and after, and compare the barrel racing time and the average daily gain of the horse. And they found that the horses after dental, they average run 1.42 second faster, and
Wow.
has an increase in average daily weight gain of 50 grams per day per animal. So
That's
that's
Wow.
pretty significant.
the time is very significant. I don't feel like the average daily gain. I mean, maybe it'd be interesting to see their stats, but that second, that's huge. Because I mean, when you're running barrels, I'm sorry, no barrel expert, but if you're trying to get through your barrels, and the really, really good people are going through them in what, like 13, 14 seconds or something. And I mean, so to shave off over a second is huge.
Yeah, so I saw this paper and it was done in Brazil. It is very impressive that they can get 1.42 seconds faster out of these horses with just dental changes.
Yeah.
I know there are some medical emergencies that can occur as a result of poor dental health. My pony has choked already, not because of a dental issue, but certainly dental issues can result in choke. And the other one, the big emergency that none of us want to deal with, is colic. Could you explain how poor dental health can increase the risk of these two emergency situations?
Yeah, so there are research in both these two emergencies that's saying dental health is part of it. It kind of all goes back to the particle sizes we were talking about in the early episodes. Choking can happen when swallowing really dry bolus or very large bolus. And like the HCF flow we talked about last episode is supposed to decrease the bolus size with it rolling to the back of the mouth. But if it's blocked by bad dental, things like that, it can just cause them to swallow something that wasn't well formed and cause choking. And there's a retrospective hospital study show most obstructions are ingesta impactions. So it is consistent with poorly masticated feed. And a lot of times, if a horse choke once, um, they are more prone to choking in the future, because esophageal can cause it can cause diverticula in the esophageal area. So it is important to keep doing it. And this research I was citing about, they did like this special balloon dilation treatment on the horses, which I don't really understand, but they do it in 9 horses, and out of the 9 horses, only 2 have dental history, and out of the 2 cases, one has really bad wave complex, and the other one doesn't have any dental work for 4 years. So pretty much all 9 horses never really had like good dentals. That's part of the reason why they had choking events. And for colic, there are several types of colic. I don't even know all of them, but the most literature linked impaction colic with dental disease. And it was like starting in like 1999 that they have first research come out that's saying dental disease is the risk factor for colic in epidemiology studies. And also, like in a research in 2023 says about 20% of colic cases have dental disease.
That's
So
quite high.
Yeah, that's pretty high. Like, not all horses colic have dental disease, but having dental disease definitely increase the risk of having colic.
Yeah, that makes
And
sense.
yeah, so it is very important to keep us in mind that colic and choke can be contributed by dental issue.
Yeah, and going back to your choke thing, because it's a word that I hear and I couldn't remember what it was. So you were mentioning that the choke can, once your horse chokes, it can choke again, and in part because it can create what are called diverticula. So I had to do a quick look up diverticula. So diverticulum is it's a medical term for where you basically end up with like a little like outpouching or hollow gets created. So, if you get a choke in your esophagus, you can end up with sort of like almost like stretching that occurs in the esophagus. Is going to make this little like hollow little pocket type of thing that then things can get caught in the future. Or you can also end up with scar tissue, right, where you actually damage
Mm-hmm.
the lining of the esophagus and then you get scar tissue buildup. So you end up with a stricture, kind of like almost like making the esophagus smaller, which again obviously is going to lead to more choke. So those are the two main reasons why you might physically might end up with more choke after you've had a choke episode. So, and as Jill will tell you, I've done a choke as well. They are scary. Like, luckily, most chokes resolve on their own, but they are really scary as an owner to go through. Changing the topic a little bit to slow feeders and things, I love recommending slow feeders to my clients, especially if they're having to reduce the amount of total like forage they're feeding because they have a weight management issue they're trying to deal with, or ulcers or something like that. I think the slow feed nets and other slow feeders that are out there are really useful. Muzzles, if your horses are grazing, are very useful. So, one last question I have is, do you see any impact of using hay nets or grazing muzzles on dental health when you look in horses' mouths?
So this is actually a very hot topic, and it was discussed very rigorously at the Equine Science Society meeting in 2025 and in 2023. There are several research come out during these time frame using different slow feeder hay nets or even the hay muzzle or hay rack to test if the incisor have abnormal wear. And most of the research, they don't show any difference. So, but there is a case that I saw that has dental wear on the incisor because of the hay muzzle. It's because it was ill fitted. It wasn't fit really well, and it's a plastic one, so it kind of scrapes onto it. But like, doesn't matter what product you decide to buy, make sure you use it the way that it's supposed to be used. And like, besides metal pipes and cribbers, most horses don't get abnormalities from using hay net because it's a soft material. They go through the little small holes to get their hays, but it doesn't it doesn't cut through or as long as it's not like wired, it's not gonna cut through it. So it's not very significantly statistically in a lot of studies.
Well, that's good to hear. I think I would throw out course. So it sounds like slow feeders in general and muzzles, you're not going to see a huge amount of concerning wear on the incisors. I would just throw out, I do see people online in some of these kind of barn hack groups and things, where they've made homemade slow feeder boxes and things, and they'll use like metal grating, as the grate, and that concerns me. If you're chewing on a metal grate, I mean, I don't know that anyone studied that, but common sense says that has to have a higher risk of causing incisor damage, like you were saying with cribbers on metal pipes and things. So, obviously, I think I would stay away from having them eat through metal grating and a sort of a homemade feeder box. I think that's probably not a good idea. But it's great to hear the other
Yeah.
things are good.
Yeah, they have to be carefully designed. So I would say go with the product that is published and have research on it that will be safer for your horse's teeth or even for your horse's hoof, like not get stuck in something like that. It's probably better than homemade a metal grid one.
Yeah, for sure. But it's nice to know, though, that 'cause it's a question that comes up a lot is, the potential for these slow feeders to damage teeth. So it's nice to hear that the research suggests that it's not something we have to be too concerned about.
Yeah.
Well, this has been a great conversation. Is there any other dental or nutrition information you'd like to share with our listeners?
Yes, I do have a lot more I want to say. If you guys let me keep talking, this will be a 7-hour episode for sure. But the most important thing I want to point out is that nutrition and dentistry are like two-way relationship. Nutritional health impact dentition, such as like sugar contents in feeds, causes carie, things like that, and um, feeding concentrate or complete feed without long stem forage promotes more abnormalities and malocclusion in the mouth. This is something that people usually forgot about because it is a two-way relationship. If you can't remember anything I say, just take away one thing. A lot of horses max their signs, and keep your horses on routine dentals with a vet or qualified EDP is very important.
Yeah, thank you so much for all your information you've shared with us over the last 2 episodes and for joining us today. We really appreciate your time.
Thank you so much for having me.
For our listeners, if you'd like to be a part of our conversation, please send your suggestions for future topics and equine nutrition questions to info@scoopandscale.com and is spelled out. You can also find Claire at clarityequine.com.
We know that if you're like us, you're probably listening to this while driving or doing barn chores. But when your hands are free, if you'd share it with your friends on social media and be sure to subscribe on your favorite podcast platform, it helps other horse lovers like you to find us.
For the Scoop and Scale podcast, I'm Jill Jackson.
And I'm Dr. Claire Tunis.
Thanks for riding along with us.